Although autoimmune diseases can be caused by a multitude of factors, many people who have them struggle with establishing boundaries. This means they experience confusion between self and non-self, and are constantly putting other people's needs first while repressing their own. The stress of their emotional repression is mirrored in their immune systems, which fail to understand which cells to attack and which to leave alone. A study done in 1965 can help to illustrate this. It looked at the healthy relatives of women with rheumatoid arthritis. 14 of the 36 patients in this study tested positive for one of the hallmarks of the disease, an antibody called rheumatoid factor, or RF. This group scored significantly higher than RF-negative participants on psychological scales reflecting the inhibition of their anger and concern about the social acceptability of their behaviors. The presence of RF suggested that emotional repression, and the resulting stress, had already initiated immune reactivity in these women's bodies. Should these women have experienced further stressful events, it's quite possible they would have developed rheumatoid arthritis later in their lives. Environmental factors and destructive coping styles contribute to the onset of disease. It's hard to believe that anyone would actively choose helplessness in the face of a crisis. But, in fact, learned helplessness is a common coping style. Learned helplessness leads people toward inaction. Even when given the opportunity to do so, they don't extricate themselves from stressful situations. Those could be anything from a dysfunctional relationship to a stifling, monotonous job. Sadly, this unhealthy coping mechanism inevitably leads to increased levels of stress over time. The key message here is, environmental factors and destructive coping styles contribute to the onset of disease. One of the author's patients, Natalie, had developed learned helplessness to cope with various stresses in her life. During the spring and summer of 1996, her stress increased to extreme levels. In March, her 16-year-old son was discharged from drug rehab. Then, in July, her husband, Bill, underwent surgery for a malignant tumor. Later, they found out the cancer had spread to Bill's liver. Meanwhile, Natalie had been experiencing occasional fatigue, dizziness, and ringing in her ears. In May, she experienced a bout of vertigo, but a CT scan showed no abnormalities. In July, an MRI finally led to a diagnosis of multiple sclerosis, or MS, an illness that impairs the functioning of the cells in the central nervous system. The causes of MS are a mystery. It's possible to inherit a genetic predisposition to the disease, but you can't inherit the disease itself. Moreover, even people who have all the necessary genes often don't end up getting MS. Therefore, experts believe its onset must be triggered by environmental factors such as stress. In fact, studies have found that 85% of MS patients had experienced the onset of symptoms in the wake of highly stressful events. Similarly, MS patients suffering from extreme stresses, like relationship difficulties or financial insecurity, are almost 4 times as likely to suffer exacerbation of their symptoms. The underlying problem, however, isn't stressful events themselves. Instead, it's environmentally conditioned helplessness in the face of those problems. Despite her MS, Natalie spent her time tirelessly caring for her husband even though he was having an affair, drank heavily, and regularly embarrassed her in public. Natalie, unfortunately, had developed learned helplessness as a way to cope with her husband's transgressions. This undoubtedly contributed to her developing MS. By never saying no, Natalie's emotions became repressed. She no longer actively experienced stressful events as stressful. But while she may have felt fine, her immune system had been left wide open to attack. Traumatic events can warp people's perception of physiological pain. Has anyone ever told you to go with your gut? It's common advice and quite sound. That's because your brain and your intestines, or gut, are in constant communication. The brain relays data to the gut from sensory organs like the skin, eyes, and ears. But first, the brain's emotional centers interpret that data. Then, the physiological events in the gut reinforce the brain's interpretation. This leads to the gut feelings we're consciously aware of. However, when we have too many gut-wrenching experiences, like trauma or chronic stress, the neurological communications channel can become oversensitized. This can lead to nerves being set off by weaker stimuli. In other words, the oversensitized person will experience greater pain than someone else would under similar circumstances. This is the key message: traumatic events can warp people's perception of physiological pain. Gut dysfunction as a result of neurological factors is particularly apparent in people with irritable bowel syndrome, or IBS. IBS is considered a functional disorder because, although it impairs the body's functions, its symptoms can't be explained by infection or any other abnormality. In patients with IBS and other functional disorders, there's a high incidence of sexual and physical abuse. This could be one factor that alters their normal nervous system response, making them more sensitive to stressful stimuli. To shed light on this characteristic, one study artificially distended participants' colons by inflating a type of balloon inside of them. People suffering from functional disorders exhibited hypersensitivity to the distension, experiencing much greater pain than control groups. But increased levels of pain weren't the only thing that set those suffering from functional disorders apart. Brain scans showed activation of their prefrontal cortex while the balloon was inflated, something not observed with the control group. This demonstrated that the brains of the patients with functional disorders interpreted physiological stimuli as more extreme. The prefrontal cortex is where the brain stores emotional memories. It's also what helps us interpret present stimuli in light of past experiences. If this part of the brain is being activated, it means that something of emotional significance is occurring. But activating it isn't a conscious decision, it's merely the result of nerve pathways being triggered. So, if psychological damage is the root cause of functional disorders, it makes sense that psychological intervention could be effective in treating them. In one study, a short series of 2-hour group therapy sessions taught IBS patients to use better behavioral coping strategies. This led to a reduction in abdominal complaints that held up even at a follow-up exam 2 years later. Certain illnesses are associated with particular personality types. In 1998, at the 9th International ALS Symposium, 2 neurologists presented a paper called "Why Are Patients with ALS So Nice?" In it, one of the authors made an interesting claim about the technologists who conduct tests to determine whether patients have ALS, a disease that attacks the nerve cells controlling muscle movement. The technologists often accompanied their results with comments like, "This patient cannot have ALS, he's not nice enough." Strangely, these predictions almost always turned out to be correct. Now, niceness doesn't seem like a particularly scientific measure. Nevertheless, the study noted that niceness is considered to be a major component of the ALS personality. Here's the key message: certain illnesses are associated with particular personality types. People with ALS, or amyotrophic lateral sclerosis, often share similar backstories, with childhoods involving emotional deprivation or loss. These, in turn, often lead to emotional repression and extreme dutifulness in adulthood, which can make someone appear unfailingly nice. Lou Gehrig, the famous Yankees baseball player, was an illustrative example of the ALS personality. Gehrig had a rough upbringing. All of his younger siblings died within a year of being born, and his father suffered from alcoholism and epilepsy. Well before he was diagnosed with ALS, Gehrig regularly exhibited extreme niceness. On one occasion, a fellow Yankee was so weak from a cold that Gehrig took him home to be cared for by Gehrig's mother. The teammate slept in Gehrig's bed, while Gehrig himself took the couch. But his niceness did not extend to the way he treated himself. In fact, Gehrig was referred to as the Iron Horse for refusing to miss games due to illness or injury even when his fingers were broken.